Hello and a warm good evening to one and all. I'm Preeta Harikrishnan, your host and moderator for today, Deputy Manager Admissions, Amrita Institute of Medical Sciences. Thank you all for joining us on this webinar on emergency medicine and intensive care technology. If you have any doubts, you could raise hands or drop your doubts in the chat box. It'll be clear towards the end of the session. So with us today is the positive and energetic doctors waiting to present before you the importance and scope of the courses, emergency medical and intensive care technology. We have our special guest for today. I introduce you to first our radiant speaker, Dr. Sabrish, who is also a consultant in emergency medical department. He's a clinical lead to Division of Disaster Medicine and also faculty for the same in India and Nepal. Doctor is a AHA certified ACLS and BLS instructor. He's a chairman to the Hospital Mortality and Morbidity Committee. He's also the president of IMA Edapalli branch Ernakulam. Dr. Sabrish has 16 publications to his credit. I welcome you, Doctor, to throw us light on the importance and scope of intensive care technology to all our attendees today. Welcome you, Doctor.
Thanks, Peter, for that very generous introduction. And yeah, dear parents and students, really happy to engage with you on this day. And as you know, today, my colleague, Dr. Srikrishnan, will also be joining shortly, and he will be taking you through the importance of the EMT course. But again, I'm kind of lead for the ICT course, that is the Intensive Care Technology course, which is being run here for the past 4 to 5 years. So this was, again, born out of a unique vision of our previous head of the department and now principal, Dr. Girish Kumar sir, who is a very astute clinician and medical educator, well known all over the country. And basically, we felt their need and a gap in the medical system where focused, trained, skilled healthcare professionals were lacking in a highly demanding area of intensive care units. So basically, as you know, the intensive care units, which we commonly call as the ICUs, are a very significant part of the healthcare system. And whatever happens in the ICU usually needs to be picked up really early and acted upon in a very judicious and timely manner to make a difference in the patient's further prognosis and life, in fact. So this is where we felt that there was a definitive need for a focused training for students. And that is how this was introduced at Amrita Vishwa Vidyapeetham Cochin campus. So again, our colleague Mr. Jashwant will be giving the specifics and the details of the program. Dr. Srikrishnan has joined. Over to Dr. Srikrishnan to take it further. Yeah.
Thank you, Dr. Sabrish.
Welcome, Dr. Srikrishna.
Welcome. Thank you.
Let me just introduce you to the attendees.
Sure.
So our special guest has again joined us, Dr. Srikrishnan, consultant again the emergency department. Doctor is a clinical lead in the Division of Transport Medicine. Some technical issue in between. Can you hear me?
Yes, very much.
Yeah, we can hear you.
Okay. Doctor, he's also the National Secretary to Indian Society of Toxicology. He's a co-editor to the International Journal of Emergency Medicine. Dr. Srikrishnan is also an international instructor to Australasian EM technicians. He's also the chairman to Hospital Resuscitation Committee. Dr. Srikrishnan has 25 publications to his credit. I welcome you, Doctor, to explain to us about emergency medical technology and its scope. Welcome, Doctor.
Thank you once again for a brief introduction. And I'm very happy to be here since 2012 is what we started our BSc EMT program. Then we went over to the MSc program in the year of around 2015-16. So that is how the evolution of paramedic program happened in the Department of Emergency Medicine. So then later on, since last 5 years, we have another branch that has come up with the intensive care technology. So these are the programs that has been running for our undergraduate students. And obviously, we have been running a lot of other programs like PhD programs and MD emergency medicine and fellowship programs. So when you come to the Department of Emergency Medicine, it itself is a hospital. So that's what I wanted to let you know, because when you look into the bigger hospitals, what percentage of beds that they need to be in the emergency room, it is approximately like 2 to 3% of the bed should be devoted to the emergency medicine. So there are a lot of hospitals which are just 50-bedded hospital, 60-bedded hospitals are there, but our emergency department itself is a 100-bedded facility. So that is what we are having in the department. And among this 100-bedded facility, we have around 15 ambulances. Among that, 8 of them are ACLS equipped. ACLS means advanced care ambulances, and the rest are the basic ambulances. And among these 100 beds, almost 30% of the bed is devoted to critical care. So that is how we have both the program we are able to run in our 100-bedded setup. So, and then again, we have an extension of another 30-bedded of an ICU in a separate area, which is under our administrative control. So again, our students will get exposure in that area also. So totally, when you look into the emergency medicine, you have like 50 critical care beds and 70 emergency medicine beds. So that is how we have divided among ourselves. So what is the reason why you wanted to choose this program? That is a big question comes in your mind, and many of the students knowingly or unknowingly join the emergency medical technician or ICT program. So whenever you call a paramedical program, it's a technician program. You think it is something to do with the technical things. So it is actually less of a technical aspects, but you are directly involved in the patient care. So that is what is very, very important here. So in majority of the technical programs, you will be dealing with the machines. You will be directly involved in doing some something in your machine, like dialysis technology. When you are doing perfusionist, you're just doing some things in the machines, respiratory technology, just to do with the ventilators and oxygen delivery devices. What is the beauty of emergency medicine or intensive care technology? It is comprising every other specialty. So we wanted to learn a little bit of respiratory therapy. You wanted to learn a little bit of dialysis technician. You wanted to learn a little bit of all other specialty, maybe a little bit of physician associate program also. So it's a mixture of all. At what is your role? What is your role? That is again very, very important. When you look into the emergency medical technician, these people are supposed to take care their equivalent. Actually, in 1980s, this program has been launched in US. That is how the emergency medical technician came up. So basically, they used to do it for pre-hospital setup. You are doing inside the ambulance. So before the patient reaches the hospital, they will be taken care by the emergency medical technician. So that is how it evolved. And when you look into the opportunities and what is the current state of affairs in India, lot of opportunities. Wherever you go, there are a lot of vacancies for emergency medical technician as well as for intensive care technology. In ICT is a little bit a newer specialty. Maybe only since last 10 years we have been, but EMT is a pretty long specialty, and it's all well versed, and all over the globe we have got opportunities to work and to learn further. So that is the difference between other programs. You're directly dealing with the patient. So you're something in bridge between a doctor and your patient. So you will be something, you'll be performing some procedure, you will be administering some medication to the patient in case of emergency, you'll be handling them, you'll be doing involved in their patient management in the emergency room, in the ICU, as well as in the ambulances. Intensive care technology, the specialty itself, it is just dedicated inside the ICU. But what is the advantage? Again, when you take intensive care technology with us, you will get a little bit of exposure regarding emergency medicine management also. Critical care means ICU care. Emergency room means it's two separate entities. But what is the advantage when you're going out of our institute? You're going to take up one of the hospitals because they may not have that much manpower to take that many number of technicians. So they might take you inside an ICU, or you can still work in the emergency room also. So it's like when you're completing your ICT program, you can be involved in both those areas. So that is the advantage of having this program. So I'm not going further. Our team member, our own student, Sai Jashwant, who has taken MSc from our institute, and we have Rishikesh and Vishnupriya. They'll be taking you through what are the career opportunities, what all things you can do, and how many students have passed out from this area. Over to you, Sai Jashwant.
welcome. Sajan Swan, sir, welcome. He has not joined, I suppose. I think he's not joined, doctor.
No, I'll just check with it. Just a minute. പ്രീതജി സായി ജഷ്വന്ത് എന്നുള്ള ഒന്ന് co-host ആക്കാം.
Okay, okay. Yes.
Got it. Yes.
Yes, welcome, welcome, sir. Welcome. Welcome to the webinar.
Ma'am.
Welcome to the webinar. We are waiting to hear
Yeah.
from you.
Yeah, ma'am. Am I audible to you?
Yes, yes, audible.
Yeah. So, very good evening to all. First of all, I'd like to thank Dr. Sri Krishnan and Dr. Sibri sir, Dr. Girish Kumar sir, to give this opportunity. So, we'll go. I'd like to share my screen. Just a minute. Once again, good evening to all. So, in couple of minutes, I think max I won't take much your time. Within 10 to 15 minutes, I'm going to cover what is the scope of emergency medicine. Like first, what is emergency medical technology and what is intensive care technology? Like how we are running that course in our Amrita Hospital, like curriculum, both EMT curriculum and ICT curriculum. And our alumni experiences also we can ask their experiences and what they are doing now, what are all opportunities they have after this also we can ask, and what are all career opportunities after completion of the course you can able to do, and further higher studies what you can do, like after undergraduation if you want to go for post graduation, or even after post graduation you can go for doctoral studies also like PhD. So those all things we'll discuss. So why you want to choose Amrita first? Like most of them know Amrita is number one in India impact rankings, and along with that we have National Assessment and Accreditation Council A++ grade, and along with that sixth best medical college in our India, and seventh best Indian university as per NIRF rankings. So you might be all known about this Amma. She is the chancellor, Sri Mata Amritanandamayi is the chancellor for this Amrita Vishwavidyapeetham. So just we'll look overview of our department along with the faculties. Department of Emergency and Critical Care Medicine, Amrita Institute of Medical Sciences, Kochi. So first you can see on left side the renowned person, you might be all aware about him, Dr. Girish Kumar KP sir. He is the principal of Amrita School of Medicine and he is the senior clinical professor in Department of Emergency Medicine as well as. And Dr. Naveen Mohan is the head of the department. Now he is currently clinical associate professor. And we have most experienced Professor Dr. Dhanasekaran sir. He is having more than 40 years of experience in teaching field. And you can see both of the pillars of this program, both EMT and ICTs. One is Dr. Sri Krishnan TP, is the EMT program coordinator in Amrita, and Dr. Sabri sir is the ICT program coordinator in Department of Emergency Medicine, Amrita. These both peoples are main pillars to run the course in Amrita. And we have along with me, these two more my colleagues are there, Vishnupriya and Rishikesh. They are also alumni students from here only. Currently now they are doing PhD in Amrita department. You can see in the images, this is a triage area. It's almost 50 to 60 bedded of triage areas we are having. Larger square feet of area, around 50 to 70 beds of triage. And for this intensive care students, separately they will be posted in this ERICU. This is intensive care unit that is specifically only for critically ill patient. This ERICU again we divide into two areas. One is P1 and one is P2. So those who are wish to study this intensive care technology, so they will have clinical postings in this ICU area. And those who wish to study this emergency medical technology, they will be have postings in triage area, and along with that, pre-hospital scenarios that also I will explain. So this is one more, especially we have that adult and pediatric ward. So no need to worry to get exposure. So here we'll get all kind of exposure. That means different types of patients along with adult, pediatric, pregnant patient, geriatric patient. All kind of patients will get to the department. So even after some days, like 1 or 2 days, couple of days, if patient required admission, so we can keep admit in our department itself. That is the benefit of having this ward again. We have 2 classrooms with all equipped audiovisual feedback devices and one simulation room also there. So each day we'll have one theory class. Along with that, whatever theory classes happen, the next day we are going to demonstrate on the mannequins. So without missing, every day the students will have both second years and third years, both the courses EMT and ICT. They'll have a theory class at early morning as well as demonstration class after followed by theory class. Then they will have clinical postings. And this is the ambulances what currently we are using in Amrita. We have almost 15 to 16 ambulances. In that level D ICU ambulances are around 8 ambulances are there. It is advanced cardiac life support ambulances. Remaining rest all basic life support ambulances. So first, what are all the courses that we are offering in our department? So one is first mainly a postgraduate program is MSc Emergency Medical Technology. If you see eligibility for this case, for this course, should complete BSc Emergency Medical Technology with 3+1 year internship, like 3 years course, along with that 1 year internship, that two regular courses only. And even we are offering for BSc Respiratory Therapy and Anesthesia Technology also, and BSc Physician Assistants. So those who completed undergraduate in BSc EMT, BSc RT, and BSc AT, and BSc Physician Assistant, they are eligible to do this emergency medical technology program. The duration of this course is around 2 years. We started this course in 2017. Like number of intake per each year is five seats. Curriculum as per Amrita Vishwavidyapeetham University. And the next we have BSc Emergency Medical Technology. Eligibility for this course, pass in +2 with the 60% aggregate marks in physics, chemistry, biology, and English. This is also 4 years course, 3 years plus 1 year mandatory internship in Amrita Hospital. And this course we have started at 2012. So number of seats currently we are intake 20 seats per year. This is curriculum also I'll explain in further slides. The next thing is BSc Intensive Care Technology. So this is also same like BSc EMT, eligibility both are same. pass in +2 with 60% aggregate marks in physics, chemistry, and biology. This is also 4 years course, 3 years course plus 1 year mandatory compulsory internship in Amrita Hospital. This course we started at 2019. Number of seats 10 per year. So alumni students passed out from this institute from 2002 to 2006, 7. You can see in the slide, almost so far more than 60 students are passed out. This BSc Emergency Medical Technology students since 2004. And ICT, one batch only passed out since we started in 2019. Last year, 2023, one batch came out, and all of them are joined in the job, and some of them are going for further studies. Now we have the current strength of students. For batch of 2020, 16 students we have from BSc Emergency Medical Technology, and 2021 we have 13 students, and 2022 we have 20 students, and 2023 we have 17 students. And intensive care technology also 2029 students we have. 2021 we have 9 students. In 2022 we have 10 students, and 2023 we have 10 students. And final year postgraduate students also we have 1 student, and 2 of them are passed out just few months. So first, before going into the course, like what is emergency medicine first? You should know what is this field, how it deals. Like, so concept of emergency medicine is relatively new to the India. Since couple of like few years back only we started and we are developing this emergency medicine. But this emergency medicine already well known, manageable in all abroad countries. So this emergency medicine is field of practice based on the knowledge and skills required for the prevention, diagnosis, and management of acute and urgent aspects of illness and injury affecting patients of all age groups with full spectrum of undifferentiated physical and behavioral disorders. It is a specialty in which time is crucial. So this all initial resuscitation will be done by emergency medicine team. Then depends upon the system of injury, what system or what organ is involved. Then we'll inform to the rest other departments. Then they will take care resting. So initial stabilization of patient is this emergency medicine department responsible. So now we'll move on to the emergency medical technology course. First, what is EMT role? Like when you took up a course, after completion of this course, what you will do? So emergency medicine professionals are first responders who assess and stabilize, transport patients to healthcare facilities. So mostly like in abroad and all, EMT is restricted for pre-hospital and even in hospital also there. But in India, pre-hospital is not developed that much with compared to abroad countries. So we are offering both in hospital and pre-hospital scenario. So pre-hospital, nobody will be there. This paramedic or EMT, whoever is assigned in that ambulance, they only need to take care of the patient by consulting the duty doctor in the department. So until reaching the scene and taking patient back to the hospital, the whole thing EMT has to take care in pre-hospital setup. So next we'll see overview of our EMT curriculum. So the main objective of this EMT program, you should know what kind of emergency it is and how to manage a cardiac arrest and polytrauma victim and transportation of critically ill patient, basics regarding to handle airway and circulatory management, and to make students self-sufficient in immediate management of critically ill, and will give hands-on training in emergency procedure, all kind of emergency procedures. So as I told, this is a 4 years course program. So 3 years you will have a course, and the 4th year is completely internship in the clinical area. So in first year, you will learn about theory classes and practicals of following subjects like anatomy and physiology, biochemistry and microbiology, an introduction to the computer application, quality assurance and accreditation, English and soft skills. So first year you will completely out of from the hospital. Like in the college, we have separate college in allied health sciences. So they will deal first year these all following subjects. Once after completing the first year, then you will come to the clinical posting area. So in department, you will have both theory as well as clinical postings. And along with the department subjects, in second year, you have to deal with pharmacology, pathology. And emergency medicine again will divide into different papers and different subjects. Like one stream is related to medical emergency, one stream is related to critical care, and one stream is related to trauma and surgical sciences. And third year again same like second year, theory classes will be there, and postings not only in emergency medicine, like they will have other ICUs and other areas also they will expose, like anesthesia, OT, and radiology, and some neurological ICU. This kind of stroke medicine posting will be there. So along with emergency medicine posting, they will have other department postings also in third year. So in fourth year completely dedicated for internship. So after successfully completing this internship, then only they are eligible to get the degree. So next, if we see career opportunities, first thing, you can join as a emergency medical technician once after completing the course. The role of emergency medical technician, providing immediate care and transport for medical emergencies. And mostly you will be posted in ambulance services or in hospital and fire departments, private emergencies. And along with this, you will have cruise paramedic, flight paramedic, like that you have to study again aviation medicine, and even on bicycle transport paramedic also there, like in some areas. So these all areas you can work to assess the patient condition and performing emergency procedure. And this next one is advanced paramedic. So after this BSc, again without BSc, there are some certification courses like diploma 1 year, 6 months. And if you are completing this undergraduate BSc program, you can call it as like paramedic. If more than that, if you studied, you will consider it as advanced paramedic. So emergency room technician, as I discussed, in pre-hospital you can work, or in hospital you can work. So inside the hospital, the role of emergency room technician is assisting doctors and nurses in the emergency room, mostly while doing the procedures in cardiac arrest scenario and while handling the critically ill patient inside the hospital, and preparing patient for examinations and drawing blood, performing electrocardiograms, and assisting with minor procedures. This is the emergency room technician role inside the hospital. And you can be an instructor and trainer also after this undergraduate program. You can train future EMTs and paramedics. And there are separate courses to complete to become an instructor and trainer to this. Basically, we have that basic life support and advanced cardiac life support and pre-hospital trauma life support. Once if you did this, all these courses certified all over the world, there is a one international organization, American Heart Association, that is offering these all certified courses. Once if you did these courses along with undergraduation, you can able to educate and training for future students. And even you can become critical care transport specialist also to shift the patient from one hospital to another hospital in pre-hospital area. And you can be a healthcare administrator also after completion of this program, mainly in emergency departments. And medical equipment sales and support side also you can go, like some companies are big companies are there. If you know how to handle the mannequins and everything, that you can deal while studying this undergraduate program, so that you can go like medical equipment sales side also, research and development. Research also, there are a lot of scope in emergency medicine. You can, if you are interested, you can go for research side also. And there is something called flight paramedic also is available after undergraduation. There is a separately course name called aviation medicine. It is a diploma, like 1 year course. You did this course, again you are eligible to do this flight paramedic and aviation medicine, because there is some differences managing the case on earth and on air. So those all things you will learn in that 1 year period of time. And you can be a team in disaster response team also after this course. And furtherly, after completion of the degree, you can do masters in emergency medical technology. And along with that, a public health sector, public health, master of public health you can do. And along with that, some other hospital administration courses also there, MBA and MHA. That courses also you can go if you wish to study those postgraduate courses. So higher studies opportunities are like again after completion of undergraduation, if you complete the PG post graduation, you can be a critical care paramedic, flight paramedic, tactical paramedics. This means like in army and all, you can be you will there is a recruitment in army and all. So you can be a army in a team of army also you can be a paramedic. And even after the same like me, like I did my post graduation in emergency medical technology, and now I'm doing this PhD program in Department of Emergency Medicine, Amrita. So if you wish to continue your studies even after PG, you can choose PhD programs. This is overview of this EMT program. So next we'll move on to the intensive care technology. So this is also well demanded course in India. So same like as Dr. Srishnan sir mentioned, doing intensive care management in our department, they won't expose not only on critical care side, they will expose on trauma side also. Since this course is offering by Department of Emergency Medicine. So they can work in critical care setup like ICUs and they can work in emergency rooms also. And next thing, uh, uh, like monitoring the equipment, recording the data, providing this data to the physician. These all things will done by intensive care technologies. So this is also 4 year course. In first year, same like BSc Emergency Medical Technology, you'll have theory classes, anatomy, physiology, biochemistry, and microbiology, English, and soft skills. From second year onwards, theory classes as well as posting in the clinical area, which is related to pathology, pharmacology, and applied basic sciences to intensive care technology and basics of intensive care technology. In third year, they'll have same like second year theory class posting in the clinical area, as well as in rotational peripheral postings also will be available in other intensive care units like neuro, ortho, this kind of setups. And fourth year is completely internship, mandatory internship 1 year. So after completion of this course, you can be a intensive care unit technologist, a critical care technologist in hospitals, like inside the intensive care units. The duties of these intensive care technologies is monitoring vital signs, operating and maintaining life support equipment, assisting medical staff with the procedures, and even you can do respiratory. So most of the hospitals, some of the hospitals, they don't have separately this respiratory therapist course, and respiratory therapists they won't afford to pay them again and to keep. So those who did this intensive care technology, they can be play a role of respiratory therapist in intensive care units. So next, they can also become an academic instructor and trainer for this intensive care students, intensive care technology students in colleges and training centers. And they can be a part of neonatal intensive care unit and pediatric intensive care unit also. So they can deal with neonates in intensive care, in intensive care units and pediatric in intensive care units. And they can go for medical equipment sales and support specialist also. And they can be a healthcare administrator. They can manage administrative functions of healthcare facilities, particularly related to ICUs. And they can be act as a patient care coordinator, coordinating the patient care plans and ensuring smooth transition between different levels of care inside the hospital. And they can be an emergency and trauma care specialist also. Since this program is offering by a Department of Emergency Medicine, they'll have a feasibility both critical care side and emergency trauma side also. So furtherly, if they want to study after undergraduation, they can go for masters in critical care and masters in healthcare administration and masters in respiratory therapy. These all courses they can choose further if they want to study. So the same thing what I have repeated in this slide. So this is the batches from 2019 and 2020 and 21 and 22. Students currently who are studying in our department. And we have a pre-hospital. For pre-hospital, I told we have this specialized ambulance services as well as inside hospital management, inside patient hospital patient management. Will allow the students to manage the case in pre-hospital scenario. So we'll send once each student for each call along with the experienced staff so that they can go and they can experience how the staff is treating the patient so that they will also get trained once if they attended repeated calls. So that feasibility also there for students to train in pre-hospital area. So that's it. If you have any queries and answers, I'm ready to answer your questions. If anybody is having any questions.
Thank you so much, Sai Jaswant for such a detailed explanation on what emergency department is on the whole. You explained it all so well. Everything was clearly told, like why they should really join Amrita. Seeing all these slides, they would surely run to Amrita. Hope they all who are waiting to really get into write their tests well and join the EMT course and to have such good doctors and people like you who will help them out. So is there anyone else who will be speaking from the department or?
Yeah, ma'am. We have my colleagues with me, Vishnu Priya and Rushikesh.
So we could give
If you
them
can
a few
able to-
minutes of time.
Yeah. Just like to share alumni experience since they have studied here only. Just
Yes,
couple of
you
minutes.
could call them. You could call them.
Yeah, they are already on the line.
Okay.
Can you just share the screen for them? Vishnu Priya and
Who?
Rushikesh.
Krishna. Is it Krishna Priya?
Vishnu Priya.
Vishnu Priya.
Yes.
Yeah, I just added. Chinnam Vishnu Priya, right? I added.
Yes.
Yeah.
And Rushikesh also.
Welcome, Vishnu Priya. Could you also tell us something about your experiences with the Amrita Emergency Department? Vishnu Priya,
Rushikesh, ma'am.
welcome to the webinar. Vishnu Priya, you could join us.
Hello, ma'am.
Yes.
Rushikesh, ma'am. Rushikesh.
Okay. Then I welcome Rishikesh. He can speak to us on his experiences.
Ma'am, is it audible?
Yes, you're audible, but there is an echo, I suppose.
Is it audible, ma'am?
Audible now.
Yes, audible. You can go ahead, Rushikesh. Can you please share your experiences from this course and like you studied from Amrita? Can you give a feedback to the students, those who wish to join in this? Just
Once again, good evening to everyone. I have completed my BSc Anesthesia Technology and I have joined the Amrita for MSc. in the Department of Emergency Medicine. After completion of my course, initially in my DSC, I don't have a more knowledge of the theoretical part and teaching part also. But coming and joining in Masters in Emergency Department and Critical Care, I was like well trained. And I was like very happy after my completion, which given my more support regarding the teaching part. And now I have continued my PhD also. So this is my best decision what I had took, and I have continued my PhD. Now I am like continuing my PhD and research today. So Amrita is the best choice according to my view, which gives a more knowledge regarding the patient related thing and so on.
Thank you, Vishnu Priya. You have really, you feel when you explain that Amrita is so good and so efficiently you could maintain whatever you wanted to do, your interest, your passion. I feel the attendees who are listening to you also would feel the same once they join us. Thank you so much.
Yeah, ma'am.
Uh,
Thank you, ma'am.
Is there Rishikesh there? Like he can also explain.
Yeah, ma'am.
Rishikesh? Is he joining us?
Now I made him to speak. I think
Okay.
he's there.
Okay, yes.
Yes, yes.
Rishikesh, welcome to the webinar. You could explain to us about your experiences at Amrita, especially in the emergency department.
Hello, am I audible to you, ma'am?
Yes, yes. Welcome.
Yes. Good evening, all. First of all, I would like to thank my teachers, Dr. Sri Krishnan sir and Shabari sir, for giving me this opportunity to speak on this occasion. So actually, if we discuss regarding this course and all, actually we are having an experience and expertise faculty here, and they have been through us through our from the past 3-4 years, and they'll guide us in a very good manner. So once if you reach here, you can get whatever you want. But the thing is, you have to read, and you have to make utilize of this time, all those things and all. So you have got everything here. I can say you can have sophisticated equipment, and you can have all the practical based sessions. All those things will be there, and classes also will be taken by faculties. Along with that, we guys will be supporting you. So I think it's a better choice. So try to utilize your time properly, and all the best for your future studies. Thank you.
Thank you, Rishikesh, for giving us your experience regarding Amrita. I think there are a few questions doubts by some candidates. I'll just read out. Doctors or any one of you could explain to them. Mainly what they want to know is what is the difference between EMT and ICT, or what is the difference between EMT nurses and casualty nurses? What is the difference in their job?
Okay, you can I answer for this question, ma'am?
Yes, anyone. It is raised by one of the students over here, attendees over here. Now,
Okay.
normally we see all hospitals in with the emergency medical department, patients all taking care of some. He's written like that. Now, is it
Mhm.
like what the nurses do? Is it like the duty of the nurses exactly, or something different? That is what he wants to know.
So actually, it's a team. It's a team kind of work. We have to actually nurses. So they will be in certain things like they will be taking care of all those like normal patients and all. So our duty is to take care of some emergency patients and critically ill patients and all. We have to take care of them. So
Oh.
usually in certain conditions and all, actually some nurses they have been very trained, and the thing is our course is something related to emergency medicine. So we have to tackle emergency cases and emergency patients. So that is that there only the difference will be there.
Okay, thank you so much. And there is another one, a curious question asking, do they also have to use stethoscope?
Yes, yes. Everyone needs to use it.
All of you have to use it.
Yes, yes, yes. Here it's mandatory by our sir.
Okay, so that is again another question raised by them. So, for like, is it like is it a 24-hour all-round duty like type of thing, or is there shift? Like whenever
Yes, yes.
the candidates would be very much anxious to know about that, because it's just after the course they would want to know how their job would be.
Okay, okay.
And
So
anyone can like any one of you could answer.
okay, okay. So basically, their duties and all will be shift wise only, ma'am.
Okay, so like
Wise only duties will be.
okay, then as Saiji said, I think they can be given the ambulance duty, their duty in the emergency department, or only experienced people are sent to the ambulance. Like,
Second year, couple of months, they don't have any shifts initially. Once if they getting used to the environment in the department, then they'll have postings in shifts, like morning and afternoon and night. So as per the shifts, they can attend their clinical postings. And as well as inside the department, there are separate sections. One is triage and one is area and one is pediatric area, one is adult ward. So we'll divide the students according to that area in rotation manner. So first 2-3 days if they work in the triage area, the next 3 days they will move on to the pediatric area like that.
okay, the
We'll
main.
rotate them. Yeah.
Okay, thank you for that. Now, what is the main difference between ICT and EMT? There is another question like that.
Yeah, actually, since we are offering these two courses, here they'll have that same feasibility, but when you go outside, EMT is completely different and ICT is completely different. Those who are doing ICT, they are restricted to only intensive care units. They are not supposed to work in emergency department. But when you study here, since they have touch of emergency medicine, trauma care side also, so they can work in this intensive care unit as well as in emergency room also. And even intensive care students also, along with the EMT students, we will send to the emergency calls also in the ambulance cases. So they need exposure of this ambulance side also. So mostly here there is no much difference, but when you go outside, there is complete difference from EMT and ICT. So those who are studying ICT, so they'll have benefit of this EMT course. You studied in Africa, but when you go outside, they don't have that opportunity to deal regarding this emergencies.
Okay. Thank you so much for that. So, but before we wind up, we have Priya from the admission office who will just explain the general outline of the admission process this year. Priya?
Thank you, ma'am. Good evening, one and all. I'm Priya, representing admissions office. Amrita Institute of Medical Science, Kochi campus. So today I'll be briefing on the admission process for the course BSc Emergency Medical Technology and BSc Intensive Care Technology for the academic year 2024. So here at Amrita Kochi campus, we offer 17 courses under BSc Allied Health Science and BSc Emergency Medical Technology EMT and BSc Intensive Care Technology ICT are among them. So coming to the duration of the course, for both the courses, the duration is 3 years plus 1 year compulsory internship. Coming to the eligibility, candidates should have attained a minimum of 17 years of age and maximum of 23 years of age on or before 31st December of 2024. Coming to the educational eligibility, you should have passed your class 12th with a 60% aggregate marks in physics, chemistry, bio, and English. Now, coming to the fee structure, for BSc Emergency Medical Technology, we have 3 categories in the tuition fees. That is scholarship, non-scholarship, and NRI. In the scholarship category, the tuition fees is around rupees 90,000. In the non-scholarship category, the annual tuition fees is 1 lakh. And in the NRI category, it is $2,500. We also have an other fees of rupees 38,450, which is common for all the 3 categories. And hostel fees yearly is rupees 68,000. However, hostel is not compulsory if the candidate is residing within 20 kilometers from the campus. Now coming to intensive care technology, the tuition fees in the scholarship category is 1,10,000. In the non-scholarship category, it is 1,40,000. In the NRI category, it is $3,000. Other fees is same as emergency medical technology, 38,450, and hostel fees is also same, 68,000. Now, selection for both these courses is through Amrita Entrance Exam Life Sciences. So, candidates who have already registered for this course have to attend the entrance exam AEEL on May 18th. So, the exam would be conducted in 3 slots, that is batch 1, 2, and 3. Batch 1 would be from 9 a.m. to 11 a.m., batch 2 from 12 p.m. to 2 p.m., and batch 3 from 3 p.m. to 5 p.m. And each candidate will have exam at any one of the slots that you have selected. Also, we have exam on May 19th also in 3 centers, that is Kollam, Alappuzha, and Kochi. So we have started slot booking from May 15th onwards. So candidates who are not able to who have not booked your slots, you can we have already sent mails from the university in both your registered email as well as in your registered mobile number. A link would be sent. So you need to open that link, enter your registration number that you've got once you've made, like when you registered for the course, registration number was sent to your email. Otherwise, also you can take the registration number by logging to your portal. So you have to enter your registration number, your date of birth, enter a CAPTCHA that is given, and download your admit card. So candidates who have not booked your slot yesterday by 6 p.m., you can now get into the link and directly download your admit card. However, some candidates who are not able to get into that link, maybe due to some technical issues, you can contact the admissions office. We'll be providing details regarding that. Now, coming to the question paper pattern for tomorrow's exam, AEEL, we'll have subjects physics, chemistry, biology, and English. 25 questions would be asked from physics, chemistry, and biology. 5 questions from English. So the total number of questions would be 80 and the total number of marks would be 240. Marking scheme would be that 3 marks will be awarded for each correct answer and 1 mark shall be deducted for each incorrect answer. So the total marks would be 240. The detailed syllabus of the AEL exam we have uploaded in the website amrita.edu/admissions/AEEL. You can also book your slots through this website also. Slot booking option is given there. So you can check the same. And once the entrance exam is over, we are expecting the results within 2 weeks. So candidates are requested to check these two websites, amrita.edu/admissions and amrita.edu/admissions/AEL. Also keep checking your registered portal, that is applyug.amrita.edu, for updates regarding the exam results. Also, for any admission related query or any issue regarding the admit card or slot booking, kindly contact us in the contact details that we have given below. Or you could also send us a mail at ugadmissions@aims.amrita.edu. Also, we have not appointed any agencies or third-party clients for securing admissions. So if you have any doubt regarding the admission process, you are requested to contact us in the numbers that we have shown here. Also, I would like to wish all the very best to all the candidates who are writing AEL exam tomorrow. Do well. So that's all. Thank you. Over to you, ma'am.
Thank you, Priya. I would just like once again try to say that those who have not able to download their hall tickets, admit card, you could just contact us immediately, and we could give you the center which is closer to you, and you could go there and do your test. So all the best for that. And one more clarity I would like to make is for the MSc AMT, we have 4 seats. For ICT, BSc ICT, we have 15 seats, and for BSc EMT, it is 25 seats. So I'm so thankful to the doctors, Sri Krishna, Dr. Sabrish, Sai Jaswanji, Vishnu Priya, and Hrishikesh, who joined us today and explained to us all about EMT and ICT. And it has been clear to all those candidates who are listening to us and who are now ready to join the courses. We all welcome you, eagerly expecting you soon. After the entrance exam, your results will be published, and then we would be seeing you soon. Thank you so much to all the attendees who have attended this webinar of today. Hope you could get in all the information that you wanted to from the slides that were provided, and also from the doctors and our alumni who have spoke to you about the whole course. Thank you once again, and best of luck to each one of you.